Hi, Dr. Mora here at Restore Orthopedics and Spine Center. I'm doing outpatient surgery today. I got the A-team with me. I got a really interesting case. This is a lady who was just walking, minding her own business, and all of a sudden she started to have terrible knee pain, posterior knee pain, and had a terrible limp after that. She had an MRI done outside, and like in many cases, the report said maybe a meniscus tear, and that's pretty much it. When she came back and she showed me the images, which I actually I tell patients I need to look at images, and actually most orthopedic surgeons do look at their own images. I found out that she had a root tear. I talk about root tears all the time for this reason. They're missed all the time, literally all the time. So this is what we have. We got a right knee. I have a camera in the outer side of the knee, and I already have a probe on the inner side of the knee. So we look at our monitor here, and you'll see my probe. My probe acts like my finger. And what we already see is this patient's starting to develop some degeneration on the inner side of their knee. Why is this happening? It's happening because they have a root tear. When you have a root tear, eventually your knee is meniscus-less. There's no meniscus, even though the meniscus is there. So now let me show you the meniscus. This is the front of the meniscus. It's this beautiful little pad. It's rubbery. It's what dissipates the force across the knee when you step. So I'm taking my probe and I'm going deep. Okay, I'm going to the back. If you guys follow my other posts, you'll remember me discussing an MRI, and I always say go to the back and look for the gap. So we're actually going to go to the back and we're going to look for the gap. We're going to go to the back and we look for the gap. So I'm taking my camera to the back of the knee. The PCL is going to be to my left. The meniscus posterior horn is to my right, and there is the root of the medial meniscus. That's the root, and here is the gap right here. So this is the gap. So on an MRI we call it the medial meniscus ghost sign, or we call it a disappearing meniscus sign. Well, here it is. This is live right here. This meniscus is supposed to be, can I have a grasper or something to grasp? So what I'm going to show you is where the meniscus is supposed to be. Thank you so much, Jay. So now I'm going to put in an instrument that's like a probe or a grasper here. Let me see if we can get in, and there it is. Okay, this is like a grasping tool. Let me lighten it up in there so we can see better. Grasping tool. Okay, grasping tool. This meniscus is supposed to be pulled, and I'm going to pull it and I'm going to attach it over there. Okay, I'm going to attach it to the bone. So we're doing a root repair here today. That's the plan. Let's see how it goes. Thank you so much. Okay, so I used, in this particular case, I just used a very simple multi-use, a pigtail type of device. This is a striker spectrum type of device. And I passed a passing wire, this very flexible passing wire with a loop on it. And it's got a suture attached to it. See the suture if you look down over here? Can you come over here from this view, please? I want to show something. I do an accessory little portal through the patella tendon, and I'm going to pull, and as I pull, you see my repair suture going in. This black suture is temporary. See, it's going in, and you look at the scope, and it's bringing in the suture. Okay, so I'm gonna do a luggage tag, which you'll see in just a second. Thank you. Thank you. A little tricky. There we go. There we go. There we go. See the luggage tag right there? Okay, that's number one. We're going to do this again in a second. Okay, so I got actually 3 sutures into this patient here. A very hard case. The poor meniscus has been beaten up. It's been like this for a long time. Like I said, undiagnosed root tear. So what I'm going to do is now pull these sutures and attach the meniscus right there. You see, I made a hole. You can see the bony bed right there. And I'm going to pull these 6 suture lines that I have and pull them to reduce the meniscus. And then I'm going to tie it on the patient's, outside of the patient in a different area. We call it tying it over a button, and that's the next step. And then we're done. Thank you.